that can negatively affect how you feel, think and act, often causing a general loss of interest in things and a persistent feeling of sadness. Many people feel that they can lift their mood with herbal teas. This might work for you too, but understand that depression is a serious medical illness. If depression is interfering with your daily life, talk with your doctor. Tea for depression. There are studies that suggest drinking tea could be helpful in the treatment of depression. A 2015 meta-analysis trusted source of 11 studies and 13 reports concluded that there is a correlation between tea consumption and a decreased risk of depression. Chamomile tea. A 2016 study trusted source of chamomile given to generalized anxiety disorder GAD patients demonstrated a reduction of moderate to severe GAD symptoms. It also showed some reduction in anxiety relapses during the 5-year study period, though researchers said it was not statistically significant. St. John's wort tea. It is not clear whether or not St. John's wort is helpful for people with depression. An older 2008 reviewed trusted source of 29 international studies concluded that St. John's wort was as effective for depression as prescription antidepressants. But a 2011 study trusted source concluded that St. John's wort showed no clinically or statistically significant benefit. The Mayo Clinic points out that, although some studies support the use of St. John's wort for depression, it causes many drug interactions which should be considered prior to using. Lemon balm tea. According to a 2014 research article, 2 small studies, in which participants drank iced tea with lemon balm or ate yogurt with lemon balm, showed positive effects on mood and anxiety level reduction. Green tea. A 2009 study trusted source of individuals ages 70 and older showed that there was a lower prevalence of the symptoms of depression with the more frequent consumption of green tea. A 2013 animal study trusted source suggested that green tea consumption increases dopamine and serotonin, which has been linked to reducing symptoms of depression. Ashwagandha tea. A number of studies, including one in 2012 trusted source, have indicated that ashwagandha effectively reduces symptoms of anxiety disorders. Other herbal teas. Although there is no clinical research to back up the claims, advocates of alternative medicine suggest the following teas might have a beneficial effect for people experiencing depression: peppermint tea, passionflower tea, rose tea. Tea and stress relief. Too much stress can affect depression and anxiety. Some people find relaxation in the ritual of filling the kettle, bringing it to a boil, watching the tea steep, and then sitting quietly while sipping warm tea. Beyond how your body reacts to the ingredients of the tea, sometimes the process of relaxing over a cup of tea can be a stress reliever on its own. Takeaway. According to the American Psychiatric Association, at some time in their lives, about 1 in 6 people will experience depression. You might find that drinking tea helps, but don't attempt to treat depression on your own. Without effective professional guidance, depression can become severe. Discuss your consumption of herbal tea with your doctor as, among other considerations, some herbs can interact with medications